The root cause of hair loss: why excessive shedding is rarely just a hair problem. If you are experiencing excessive hair shedding or progressive thinning, the most important question is not what product to use first. It is, what is the true root cause of hair loss? In clinical and professional settings, hair loss is rarely an isolated cosmetic issue. Instead, it often reflects deeper systemic imbalances involving blood sugar regulation, stress hormones, thyroid function, gut health, and nutrition. At FOND Hair and Scalp Care, we approach thinning hair through a whole-body lens, because healthy hair begins beneath the surface. Why hair follicles are highly sensitive. Hair follicles are among the most metabolically active structures in the body. Because of this, they respond quickly to internal stress signals. When the body detects imbalance, follicles may prematurely shift from the anagen, growth phase, into the telogen, shedding phase, a condition commonly known as excessive shedding. Understanding the underlying drivers is the first step toward meaningful recovery. Insulin resistance and frequent insulin spikes. One of the most overlooked root causes of hair loss is unstable blood sugar and frequent insulin production. How insulin affects hair. Chronic insulin elevation may increase androgen activity in sensitive individuals, promote inflammatory signaling, impair microcirculation to the scalp, disrupt the natural hair growth cycle. This pattern is commonly observed in individuals experiencing diffuse thinning PCOS-related shedding, increased scalp oiliness. Here's what helps support balance. Emphasize on eating low-glycemic whole foods. Reduce refined sugar and ultra-processed carbohydrates. Include quality protein and healthy fats at each meal. Maintain consistent meal timing. Improving insulin sensitivity often supports healthier hair density over time. The hormone-gut microbiome connection. Your gut microbiome plays a central role in hormonal balance and nutrient absorption, both critical for healthy hair growth. When the gut is imbalanced, microbiome disruption may contribute to poor absorption of hair-supportive nutrients, increased systemic inflammation, impaired hormone metabolism, heightened immune reactivity. Supportive lifestyle practices. Increase plant fiber diversity. Incorporate fermented foods when appropriate. Reduce excessive alcohol intake. Minimize highly processed foods. A resilient gut environment helps create the internal conditions necessary for sustained hair growth. Elevated cortisol and chronic stress. High cortisol is strongly associated with stress-related hair loss and telogen effluvium. How cortisol disrupts hair growth. Persistently elevated cortisol can shorten the growth phase, increase follicular inflammation, reduce nutrient delivery to the scalp, interfere with thyroid hormone conversion, disrupt sleep-dependent repair, practical stress support strategies, maintain consistent sleep patterns. Practice breathwork or mindfulness. Engage in moderate, regular movement. Get morning sunlight exposure. Lowering chronic stress load can significantly reduce shedding in many individuals. Thyroid function and hair thinning. Thyroid imbalance, especially underactive thyroid, is a commonly missed contributor to diffuse hair thinning. Why thyroid health matters. Thyroid hormones regulate cellular energy production, protein synthesis, hair cycle timing, skin and scalp turnover. When thyroid signaling is suboptimal, hair may become finer, slower growing, and more prone to shedding. Health considerations. Maintain balanced nutrition. Ensure adequate selenium and iodine within safe ranges. Manage chronic stress. Work with qualified healthcare providers when appropriate. Diet quality. The foundational driver, hair, is considered non-essential tissue from a survival perspective. When nutrients are limited, the body diverts resources away from hair production first. Common nutritional contributors: low protein intake, iron insufficiency, zinc deficiency. essential fatty acid imbalance, highly processed food patterns, hair supportive nutrition principles, prioritize high-quality protein, eat mineral-rich whole foods, include balanced omega fats, stay properly hydrated, reduce inflammatory food exposures. Consistent dietary quality is one of the most powerful long-term strategies for supporting fuller hair. The FOND Professional Scalp Solution. Topical scalp health remains a critical piece of the hair growth equation. A compromised scalp environment can lead to follicular congestion, microbiome imbalance, reduced oxygen delivery, increased breakage and shedding. How FOND Hair and Scalp Care helps stop shedding. FOND's clean science professional formulas are designed to support the scalp microbiome, maintain optimal pH 4.5-5.5, reduce follicular stress, strengthen fragile strands, create an ideal environment for healthier growth. Recommended professional system: Revitalize Plus shampoo, gently cleanses without stripping essential moisture. Revitalize Plus conditioner, restores hydration, elasticity, and manageability. Nourishing Plus hair and scalp leave-in treatment, provides ongoing scalp support and fiber protection. Used consistently, this system helps create the external conditions necessary for stronger, fuller-looking hair. Continue your root cause healing journey. For readers seeking a deeper natural framework for restoring whole body balance, the book Health Mastery by David Paris explores integrative lifestyle strategies designed to support the body's innate healing capacity without reliance on harsh interventions. Lifestyle strategies designed to support the body's innate healing capacity without reliance on harsh interventions. Final takeaway. Excessive shedding and thinning are rarely isolated events. Most often, they reflect a combination of metabolic imbalance, hormonal disruption, chronic stress load, nutritional insufficiency, scalp environment breakdown. By addressing both internal drivers and external scalp health, you create the strongest pathway toward visibly fuller, healthier hair. This video is provided for educational, informational, professional salon training, and general wellness purposes only. It is not intended to diagnose, treat, cure, prevent, or mitigate any disease, medical condition, hair loss disorder, scalp disorder, nutritional deficiency, hormonal imbalance, autoimmune condition, or dermatological condition.